Hello and welcome to HCA 528 Health Policy here at Salve Regina University. Before we get into the purpose of this course, I want to give you a brief introduction of who I am. My name is Ken Moore. I'll be your instructor in this course. I am currently Vice President for Data and Analytics at AirCare Health, and we are a company that specializes in providing healthcare services and also behavioral health counseling to employees at large employers around the country. Prior to this, I was a senior program manager for the analytics practice at Impact Advisors. I also headed up the analytics advisory practice at Huron Consulting. And prior to that, I was the head of the analytics group at Blue Cross Blue Shield of Rhode Island here in Providence. So the course itself, this course will cover major health policy issues and things that contribute to national health policies in the United States. And we're going to get at the methodology for policy planning and goal setting, resource allocation and plan implementation, and also evaluation and regulation. So the objective here is to discuss and evaluate major trends in health policy here in this country. And those trends include healthcare costs, access to healthcare, healthcare utilization, population health management, and provider effectiveness, and also social determinants of health. So the course itself is divided into three major areas that you'll be asked to contribute. The first is a group research project, which is 1/3 of your grade. The second is an individual research paper, which you'll be. I would ask that you give me a topic by the end of next week, and that is a 5 to 7 research, fully researched paper on that particular topic. There are suggestions for the paper in the syllabus. Although if you have an idea that goes beyond those suggestions, feel free to bring that up and we can discuss it. I also ask that you participate in online discussions. There'll be a discussion topic posted for each week, and those discussion topics are currently in the syllabus. Now let's talk about the group research project. You'll be split up into groups of 3 or 4. In those groups, from among your groups, you can choose from one of 2 topics to deal with in your research project. Either a examination of healthcare costs or an examination of hospital readmissions. So on the healthcare costs project, here is the scenario for you. It is March of 2025. You are the senior health advisor to the President of the United States. The country is struggling with healthcare costs that are out of control. Healthcare costs are over 18% of our gross domestic product and will choke off the economy completely if those growth rates are allowed to continue. So your task is to develop a series of recommendations to the President for what you believe is the appropriate national response to bring healthcare costs down, while simultaneously protecting access for quality healthcare for all Americans. You need to show with appropriate data and research how your plan would reduce costs and meet these objectives. And I am looking for specific examples of initiatives that would bring down costs with estimates of what those cost reductions would be. I want you to show your work on this. And I had a group last time who gave me a series of recommendations to reduce costs that all involved spending more money. And so there was an issue that didn't quite add up. So I'm asking you to dig a little bit deeper and give me some actual estimates as to how you think your initiatives would bring costs down and by what levels over what period of time. The second project is a hospital readmissions project. So in this situation, you are the chief health officer for a major hospital system in the central United States. Over the past year, your system has been plagued by an increasing rate of avoidable patient readmissions. These readmissions are resulting in poor patient quality and outcomes, not to mention increased financial penalties being levied upon you by both private insurance providers and the Center for Medicare and Medicaid Services, or CMS. So your task here is to develop an analysis of the problem along with recommendations to the health system CEO and the board of directors. And again, as with the other project, you need to show with appropriate data and research how your plan would reduce hospital readmissions and improve the quality of patient care. So what I'm looking for with these group presentations is the following. I'm looking for 10 to 12. There's 2 pieces to this. First of all, I'm looking for a 10 to 12 page paper, which you put together with your group collectively, where you outline your research questions, your discussion, your data, and your conclusions. I'm also looking to you for you to prepare a slide deck that would be appropriate to convey to the executives you're producing this report for, whether it be the President of the United States or the CEO of your hospital system. I am asking the group to give the presentation to the class at our last online meeting in May. Now, I am not grading you on the quality of your presentation in terms of your presentation delivery. I am grading you on the presentation itself, but not on your delivery. So if you're shy about speaking in public, it's okay. This is not a public speaking course. You don't need to worry about that. I'm interested in the quality of the presentation itself. You're also free to divide up giving the presentation however you choose. If you want one person in your group to give the presentation, that is absolutely fine. If you want to segment it and divide it up and give different people different parts of the presentation, that is also entirely fine. Just as long as you stick within the 20-minute guideline, you should be fine on that. Another comment I want to make on both of these projects is that, especially in the project dealing with the healthcare costs, I'm asking you to be the senior health advisor to the President of the United States. One of my frustrations in dealing with health policy debates in this country over the past few years is the extent to which they have become political and the extent to which they have become partisan. So for the purpose of this exercise, I want you to assume that the president you are writing this proposal for is somebody you agree with. It could be a fictitious person, it could be whomever. It is somebody you agree with. I do not want to read slagging on some administration versus some other administration or anything like that, or people devolving into political talking points. That is not what this is about. This is about policy and what is the best policy move for you to recommend doing, and please keep it at that. I think because that's where I think the learning is going to happen here. This is not about getting into a revisiting of our current set of political squabbles that we're dealing with. So this is the class schedule for the 7 weeks of this class. So we'll be having a class meeting on the 19th at 6:30 p.m. and another class meeting on May 9th at 6:30 p.m. The first meeting will be going through what we're looking at for each what we're looking at in terms of setting the tables for the course itself. And then the last meeting will be where we go through the group project presentations. So that gives you kind of an idea on this. Now there are different things due on different weeks. I ask you to please follow the schedule closely, and also keep in mind this is a 7-week course, and so things are going to move very quickly. Time passes very. I mean, it's less than 2 months to get everything done. Now you'll see there are references from the textbook from different chapters. I'm asking you to go through. We are not going to be talking about the book in the class. This is reading I expect you to do, and it's information I expect you to be able to absorb. But I'm not asking you to bring anything to the class. It's a separate reading on that scale. So now that we've talked about some of the requirements of the course, I do want to give you a little bit of background in terms of where we are with our current healthcare system today. The United States is the most expensive healthcare system in the world. When I gave you that assignment around healthcare costs, that's because it's a very important topic, and you'll see as a percentage of GDP, our expenditures on healthcare are approaching 20%. That means for every dollar that we spend in our economy, whether it's everything from buying a soda at the local convenience store to buying a car to buying a house, everything that goes into our economy, almost 20% of it goes to healthcare. And compared to other countries in the world, that is insanely high. And that is certainly a crisis that we have within healthcare that is sadly not being paid attention to. So, and we also get less for what we spend on. So you see our per capita expenditures in healthcare as of And I think this is a couple of years old. This is actually 2018, and the numbers are even worse now. We're almost double the rate of the nearest country, which is Germany. These numbers are really very far out of whack. And also, healthcare premiums are going up. You'll see that the premiums and deductibles have been rising faster than wages over the past decade. So we're spending more and we are getting less in the process. So how did we get here? I'm going to give you a little bit of a history of health policy in the United States, kind of going back really to the beginning. So this goes to the turn of the 20th century, was when we had the first discussions around having national health insurance and national health care as a part of the American framework. And this goes back all the way to President Teddy Roosevelt and his progressive policy. Then you had in 1929 you had the first prepaid hospital insurance plan for a group of school teachers. This was kind of the beginning of what became Blue Cross Blue Shield, and that was going back to 1929. In the 1930s, we had the Great Depression from 1929 to 1939. You had the Social Security Act enacted in 1935, and then you had the National Health Survey conducted to assess our current health and underlying social factors, and that's when you had the first national healthcare bill was introduced in 1939. While it didn't go anywhere, it started that process along the way. And then the first Blue Shield plan started to appear also at around the same time. And the Department of Health and Human Services was created in 1939 during the middle of the Roosevelt administration. In the 1940s, you had President Franklin Roosevelt outlining an economic Bill of Rights, including a right to adequate medical care. You had in 1944, the Social Security Board called for national compulsory health insurance back in 1944. You had the beginnings of incorporating access to health care within things such as collective bargaining agreements. So you were starting to see it percolate as a political issue back in the 1940s. In the 1950s, the Joint Commission on the Accreditation of Hospitals, it was JCAH, a forerunner of JCAO, was formed. You had the Revenue Act, which excluded employer contributions from taxable income for health insurance benefits. You had the first government-backed health insurance for families of the armed forces back in 1957. And then you had unions in the 1950s endorsing the creation of government health insurance. In the 1960s was a watershed decade for health policy, and then 1965 was when you had the creation of Medicare and Medicaid, and so that was 60 years ago this year that Medicare and Medicaid were rolled out. Medicare for senior citizens, Medicaid for the poor, and those services were enacted in 1965, and they are a ubiquitous part of our society these days. In the 1970s, you saw supplemental security income, SSI, beginning to provide cash assistance to elderly and disabled. You had the ERISA Act, which attempted self-insured employers and state health insurance regulations. You had in 1977, President Jimmy Carter proposed expanding Medicaid for children under 6, although that proposal didn't get out of Congress that year. In the 1980s, you had significant expansions of Medicaid in different states. You had the introduction of diagnostic resource groups, or DRGs, for hospital payments. That was 1983. For those of you who have worked with healthcare data in hospitals, that's when we first saw DRGs. In 1986, you had COBRA enacted, so there was to provide a transition from employees who were moving from one job to another and perhaps not without health insurance to be able to carry over that insurance coverage into other areas. In 1987 was when you had the Census Bureau begin to estimate how many people did not have health insurance, at which point it was determined that approximately 13% of the population did not have health insurance in 1987. In the 1990s, you had You had President Clinton uh, proposed one of the major initiatives to reform healthcare, and this was actually the First Lady Hillary Clinton was heavily involved in it, and it was quite a political firestorm at the time, and while it didn't get anywhere, it did it did continue to get those seeds planted to continue the discussion on that. You also had the Health Insurance Portability and Accountability Act, or HIPAA, was put into place in 1996, which both restricted the use of pre-existing conditions and coverage determinations, and also set standards for medical records privacy. Those standards for medical records privacy were set at that time and continue to this day. And you also had in 1997 the state CHIP program was enacted, which covered children on Medicaid and other programs. In the 2000s, you had the debate around what ultimately became the Affordable Care Act, and there was universal coverage legislation passed in Massachusetts, which was ultimately the basis for the creation of the Affordable Care Act in the Obama administration, which happened in the early 2010s. But the seeds for that were actually planted in Massachusetts in the late 2000s by the passage of that Universal Health Care Coverage Act in Massachusetts. In the 2010s, that's when we had the signing of the Affordable Care Act, which a piece of legislation which was very controversial at its time, was actually very unpopular when it was first announced, and has become more popular over the years. And there were a number of initiatives to repeal it, or quote repeal and replace it. None of those initiatives have succeeded up to this point. And there were also a number of initiatives to overturn the Affordable Care Act in the courts, and those initiatives were also largely unsuccessful, although they did manage to invalidate a couple of pieces of the act. In the 2020 and now into the 2020s, we had at the start of the 2020s, we had the COVID pandemic, which was a massive upheaval in healthcare and what that all did in healthcare. And it changed basically every operational and management deficiency in healthcare was laid bare as a result of the COVID-19 pandemic. And so that was a challenge that felt across the entire system, where people were monitoring things such as emergency room utilization. They were monitoring things such as where we were in terms of bed access and access to tests and everything. It was a very, very difficult time across the board. And also one of the offshoots of this was the fact that telehealth became more accepted as a medium for delivering care. That was something that had been kind of on the fringes up to that point. Then we had we had actions taken by the Biden administration to lower the cost of insulin in 2023, 2024, and now we have had the new Trump administration take office, and what their agenda is as far as healthcare goes is kind of anybody's guess, and we're living all that on a day-to-day basis. So that is a brief summary in terms of where we are from a decade by decade basis on our healthcare system. So that is kind of a summary as to where we are. Now there are a couple of other videos that you have. This is one of them on why healthcare is more expensive than ever. I ask you to take a look at that. And in general, I'd like to welcome you to the course, and I'm available if you have any other kind of questions or anything that you like to go with. I look forward to meeting all of you this coming Wednesday, and we will take it from there. Again, thank you very much.